Whether you're living with a chronic disease, looking for affordable housing, navigating the healthcare system, living in a rural community, aging in place, providing care to a loved one, or planning for a new family, all of these situations can be difficult to navigate without a support network or someone who can connect you to necessary resources.
There's a passion and a commitment, I think, that comes with the role of the community health advocates, the community health workers in general, whatever the terminology is that's used to describe them. It is not someone who is waiting back for someone to approach them. It is ideally someone who sees a need and can troubleshoot and have access to resources. They can figure out, how do we leverage the resources that we have to provide better care for whomever it is that they're interacting with.
We need someone who can not only provide help, but also someone who has empathy and can share in the same lived experiences as the communities they serve.
I think community health work found me. It's not a career path that I chose necessarily, but through my own lived experiences and the things that I went through being a single mother of 3 and having challenges taking care of them, I kind of fell into the community work and wanted to give back.
So after going through all of my treatment and realizing how important it was that I had all these support systems, I really wanted to try to find a way to give back. So I did some research online and I found Network of Hope, and I reached out to them and did some training, became a volunteer, and I just started doing that in the past few months. So I'm really looking forward to getting more involved. I would really love to be able to give back to other women starting out on this journey and be able to just provide that support to people that I got along the way.
Community health workers are trained individuals who are there to assist with navigating life, connecting you to the resources you need to thrive. They play a vital role in bridging the gap between healthcare systems and the individuals they serve.
There are some key differences between a social worker and a community health worker. Oftentimes our medical social workers are more focused on things like placement after a hospital discharge, providing supplies like durable medical equipment, or arranging home health services. And they're doing that as the patient presents to either the clinic or the hospital. The community health worker, on the other hand, is engaging with the community in their environment, in their homes, and where they live and work, and developing that relationship, sharing information in a more informal way to help them access healthcare and connect to social resources.
CHWs partner with local organizations to connect people with resources like food, housing, and mental health services.
And CHWs help take care of the resources and the things external from the body. Everything from being a linkage to food, nutrition, to education, transportation, housing. CHWs are just another crucial part of the team that gets to help function outside of the health system and not so much within. However, I will say CHWs do have a role within the health system because they are knowledgeable around health conditions and chronic disease. So they really wear many hats, but they're just another anchor for the health team.
The community health workers look different in different places. And so what we want to do and what we aspire to do is to make sure that whatever resources that we can give towards this movement, again, whether it's financial, whether it's the thought leadership, whether it's technical support, that is truly reflective of the communities that we're serving. And also that the community health workers that are working in these positions are absolutely reflections of those communities.
The work that we're doing here in Georgia, which is to really collect information on community health workers across the entire state, is extremely important. We want to really be able to continue to strengthen the infrastructure of community health workers across Georgia. And so the work that we're doing here to collect data to really understand the impact of community health workers, where they're located, who their employers are, and the impact that they have across Georgia is instrumental in really continuing to build the infrastructure and sustainability of community health workers.
Community health workers are the heartbeat of their neighborhoods, dedicated to improving health and well-being, one person at a time. Community health workers, it's all under their umbrella.
My name is Micah Fuller. I'm a CHW in chronic disease.
My name is Charlene Turner. I am a CHW worker. I work in community engagement and training.
My name is Dexter Cooper. I'm with KDH Research and Communication in Atlanta, and we are CHW allies.
I'm Mary Kate Davis from Morehouse School of Medicine, and I am a community health worker in research.
Do you know your community health worker? To learn more, call 404-413-0198 or visit www.gachw.org. If you're currently doing community health work, you can help strengthen the infrastructure of the workforce by taking this brief 5-minute survey. Scan here to be counted.